This is She's on Call, a weekly show hosted by ENT specialist Dr. Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's on Call, hashtag She's on Call. Please welcome our hosts.
Hello, I'm Dr. Sujana Chandrasekhar. I'm an ear, nose, and throat surgeon in New York City and New Jersey.
And I'm Marina Kurian. I'm a general surgeon and a minimally invasive surgeon in New York City. And welcome to She's on Call, you guys. We have another great episode. It's number 22, if you can imagine. It's so, but it's a great way to spend our Sundays, and we're so glad to share what we do with you guys.
Yes, we have. It has been quite the challenging year for all of us, and today's show is devoted to mental health. We'll be welcoming our guests in a few minutes. They are Dr. Jessi Gold and Dr. Victor Pereira-Sanchez, and we're going to have a show dedicated to mental health from childhood through adolescence, through college years, and the mental health of adults and healthcare workers. So I think this is something that is foremost in our minds these days, and we're really happy that you are joining us for it. Please let your friends know by sharing and liking and tagging on Facebook, YouTube, and Twitter. On Monday afternoons and Tuesday mornings, we're on WBAI. So thank you so much for joining us.
Yeah. First, though, you guys know if you watch the show that we're going to just kind of hit the news of the day. And boy, have we had a great week. We originally were actually so thrilled to get our guests because they're complete Twitterati and, we're big, huge fans. And so we were really thrilled. But then we were like, hey, post-election, stress, depression, anxiety, let's do a show. And so it just worked out perfectly.
Yep. So we had some great news in the United States, no matter what your politics are. The glass ceiling, which, it is a glass ceiling, I guess, was shattered. The United States of America elected its first woman to the executive branch. Senator Kamala Harris of California, is now Madam Vice President-elect. She is the daughter of a Jamaican man and a South Indian woman. And I'm not going to lie, seeing that picture of her and her sister and her nieces with her grandparents in Tamil Nadu, India, is quite something.
It's really great. And that other picture was of, oh gosh, I'm going to blank on it right now. Let's see. That other one. You loved it. It's by Bria Geller and Good Trouble from Clear Cider. And it's showing that the shadows of Ruby Bridges when she was walking to an all-white school, newly desegregated back in 1960. So that was 60 years ago. And, what I also thought was very powerful was the picture of her standing next to the past, I don't know how many vice presidents, right? And she's the only woman. I just thought it's great. It's only just about time. Probably every other major country in the world has had a woman in leadership. And so, hello, we did
it. And, last night when she was talking, she said, dream with ambition, lead with conviction, and see yourself in a way that that others may not see you, simply because they've never seen that before. And I think, Marina, that's the basis of this show and, frankly, our careers as we broke our own ceilings to get to where we are.
Yeah, I completely agree. So that's been exciting news, and people have celebrated. Other people are not so happy, but that's okay. I think in the end, the message is clear that we've opened the door. We've had certainly other female vice presidential candidates, but this is the first time they've been elected, and it's been really wonderful. Sadly, we still have to talk about COVID. Okay, so we should just give a quick update what's happening here and worldwide. We're still seeing huge waves, and we have a couple of slides that will show you what's going on nationwide in the U.S. And you can see from this that our testing is there, but we're also seeing a rise in the daily cases. And I think that we went over, well over 100,000. So we saw 116,000 just recently. It's a lot.
Yeah, and we also have 53,000 people currently hospitalized and over 1,000 people dying per day, actually over 1,100 people dying per day for the last few days. If you look at the map, the black states are where the severity of disease is the highest. So in the upper Midwest, the severity of disease as determined by hospitalizations and deaths is tenfold higher than if you look at New Hampshire, which is indicated in yellow. So if there is no change in strategy, another 150,000 Americans are expected to die by the end of this calendar year, adding to the over 235,000 who have already died from COVID. So we are seeing a new administration that's going to take over in January. I know that they're going to appoint new task forces, new groups to oversee this, but whether you're happy or sad or indifferent, whether you're protesting or dancing in the streets, please wear a mask, because if we wear masks, if we all wore masks, we could cut that projection of 150,000 deaths by more than half. So we can do it. We can help our own communities.
That's absolutely true. There's been so much discussion about wearing a mask, not wearing a mask. Both Suj and I, thankfully, are both on the same ground that masks do help. And I think if we're in a closed environment, and with other people that are not in your bubble, you should be wearing a mask for sure. So we want to talk a little bit about COVID, because people think, and I honestly, and certainly not as any disrespect to all the people who have gotten it and suffered, because I've seen some of my patients have COVID and then recover. Originally, when this was happening, I kind of was like hopeful, like I was sick in February. I'm like, maybe I had it. And I would, and I know a lot of people felt when we were in the throes of it in March, and just being super careful that it would be nice to get it and not be one of those people that had not significant symptoms. So what we're finding out is you can be asymptomatic, like a lot of the college kids have been. They get it and they maybe have a fever a little bit and then they're better. But what we're seeing is that you can have long-lasting symptoms, which are very problematic. And they're identified maybe 4 syndromes. One is what they're calling classic post-critical illness syndrome, and it can have fatigue and brain fog. But some of the patients are seeing a persistent organ damage after the virus, and others are seeing a roller coaster of symptoms, meaning that they might breathe in and get like a little chest pain one day, and then another time they still have achy joints. I ended up seeing a patient, Sujana, that had respiratory symptoms, and then she's like, I'm so fatigued. I'm thankful that we're working from home, but she's like, it's hard for me to get through a Zoom call. And then when she breathes in, she's still having pain. She managed to drag herself to my office for a follow-up appointment, but she's still feeling it, and she got it in March, and I just saw her in October.
Same thing. I saw a lady in her 50s, and she came in overweight, with a cane, with oxygen, in a very snazzy backpack. I have to say, she had jazzed up her backpack so she didn't look quite as sick as she felt. But she said, you didn't know me, but before COVID, I was walking miles. I was doing all my work. I was normal. And she's one of these long haulers. So it's not all gloom and doom. I work at ENT and Allergy with a wonderful laryngologist whose name is Jonathan Aviv. And he and Byron Thomas Shaw at Columbia, who's a lung specialist, and I wrote a paper that some of these patients who can't get through a Zoom call without getting short of breath, who can't do karaoke or sing or really have normal levels of exertion without getting short of breath, and their chest x-rays and their chest CAT scans are normal, we do 2 tests on them. We do an incentive spirometry where they breathe in and they breathe out, and we measure how much air is moved. And in these patients, they can't get the air in, so that lower inspiratory wave is flat, but they can get the air out. And when we look at their larynx in the office, we see that their vocal cords, instead of just staying open when they're breathing after they speak, slowly shut. And they can actually stay shut for a good 9 seconds before they open again. And this, we're thinking, is a post-viral vagal neuropathy. The vagus is one of the nerves that controls your vocal cords. And if you identify it and you treat with a low-acid diet and voice therapy, we can get them back on their Zoom calls. We can restore that part of their quality of life, which is very exciting.
I don't know that anybody wants to get back on their Zoom calls right now. But anyway, listen, we are so excited to have our guests join us. It's just perfect timing and so much to talk about. And our guests are Dr. Jessi Gold. She's assistant professor of psychiatry at Washington University in St. Louis. And Dr. Victor Sanchez, Pereira-Sanchez, he's a psychiatry fellow at NYU. And both of them are like really global leaders, I think, not just Twitterati. You should follow them on Twitter, but they've actually made serious gains. Jessi, focuses on the mental health of college students and healthcare professionals, as well as adults. And she is a founder of Time's Up Healthcare, and we're going to talk to her about that at the end. And then Dr. Pereira-Sanchez is the founder of the World Network of Psychiatric Trainees, and he also is a child and adolescent psychiatry fellow. So we're just so thrilled to have you guys join us.
Hi, good morning. Thank you very much.
Thanks for having us.
Good morning, welcome. And just a reminder, we're live on Facebook, YouTube, and Twitter. We have people checking in. Dr. Mojica is checking in from Nicaragua, and hopefully that country is doing well after the recent hurricane. We have one of our viewers said she likes the word shieling. We should add that to our vocabulary. But let's check in right away with you, Jessi, if you don't mind. This the American Psychological Association did a study, did a survey, and they found that 68% of people, no matter what their political persuasion, felt a great deal of anxiety related to the election that just occurred in the United States. Can you talk to us about, and then of course, this has been the year of anxiety. That should be like its moniker. So can you talk to us a bit about anxiety, what's normal, what's potentially worrisome, what people should do about it?
Sure, absolutely. I think the election, you're right, is like another compounding factor on what has been a really hard year for people. Anxiety was a problem for people long before COVID, long before 2020, and has just been worse, right? So anxiety is preyed upon by uncertainty, and name something that is not uncertain right now. We can't tell you when COVID's ending. We can't tell you when kids are going back to school. We can't tell you if you're going to get your job back and what that's going to look like. We can't tell you what the workplace is going to look like. I'm probably giving everybody anxiety just talking about all of that right now. So all of those things are things that compound existing anxiety for people or might cause new anxiety for people. And I think what anxiety can look like is basically like, so you can get physical reactions to anxiety. So, your heart rate can go up, you can have trouble breathing, you can have difficulty sleeping. All of that is actually like a evolutionary response to it and pretty normal, but it becomes more of an issue if it interferes with your life. So if you're having trouble day to day, you can't actually do your relationships, you can't actually go to work, you can't actually function, you can't actually do the things that you want to be doing. Those are the times that you start to get concerned. Also, if it lasts a lot longer, so lots of people don't sleep for a day, right? If you can't sleep for like a week, 2 weeks, then you start to be more concerned. So I think we start to look at like timing, how long it's lasting and how severe it is, like how much it's interacting with your day-to-day life and affecting your relationships in your work life.
And then can you give us little pointers on how we manage sort of the normal anxiety? I mean, this week, I think sleep was off the table for everybody, and everybody felt the way we felt as interns. So there you go, audience. But can you tell us, like, how do we manage that sort of everyday anxiety that, we just don't want to experience?
Yeah, I mean, I think, easier said than done. So self-care, self-care, self-care. So that can look really different for different people. So I think we try to shove like coping skills that work for everyone onto us. So we hear of things like mindfulness and we're like, that must work for me. But I think we have to find what works for us. So we can try on different coping skills and see what we like, and different coping skills work for different situations. So we might try mindfulness and that might work for one of us. We might try that and not like that. We might like exercise because we might be a more physical person, and that might be something we like better. We might need social media breaks, and that might be something we need to incorporate into our life. We might need to say no news before bed, and we might need to start doing like reading before bed or something relaxing before bed. I know for me, I had to move my phone out of my room a little bit and to stop doing social media before bed because I was just scrolling and scrolling and scrolling, and that was not really healthy. And I've had to like adjust what that looks like so I can sleep. And I've had to try to like listen to a relaxing podcast or read a book that has nothing to do with the news so I can sleep at night. And I think that's been really helpful. And I think those kind of things are definitely things you can do in the moment. Longer term coping skills, things like therapy. I'm a big, big fan of. Go myself will continue to be a proponent of that and talk about that. Think it can help everyone. And I think those kind of things can be a benefit in the long term for sure.
Jessi, thank you so much for that. And Victor, your work with children, there's been a New York Times article recently talking about how to discuss the election and what you're seeing between the celebrations and the marches after, and also probably also this discussion of legitimacy of the election, and how you talk about election with your kids. What do you think about this? And what do you think are some of the best practices to discuss this as the country is transitioning?
Yeah, so one of the things that this article was pointing out, and based on a survey, is that kids from different ages, but schoolboys, schoolgirls, and teenagers do care a lot about elections. They are interested, and also that they are exposed to the media. We cannot pretend that the only information about politics will be the ones that parents will provide them. They are in their social media. They are watching the TV, and they perceive very well the reactions of the parents. They perceive that if their parents are excited, if they are nervous, if they are celebrating, and want to understand why. So it's important to talk. For children, this excess of information, as for adults, but for children is worse. Can be overwhelming, and they cannot. Yeah, they may have it difficult to manage how what is true, what is not true, what is going on, if it will be having a civil war or not. They can get scared. So it's important that the information they receive is shared with the parents, that the parents would actively discuss with them what they are reading, what they are watching. Also, that they limit what they receive, and maybe watching the news together, maybe discussing about. I think it's a very good opportunity for parents to discuss about their values and explain to your kids, well, why I was voting, and why I was reacting with anxiety, or why now I'm celebrating, or now I'm not celebrating. And it's also now in this transition period, I think it's good. It's a good opportunity to show kids that also adults care about the rules, and now I think it's clear what should happen. So if now kids are seeing, that there's a disruption, that some people are not willing to accept what the rules of democracy, it's also a bad example for them.
I think also, what's different with adults is, and we had record turnout, right? Record turnout for voting. We have the opportunity to vote, where kids may have strong opinions. Certainly, from middle school on, you have strong opinions about what's happening in the world, and yet they don't actually have the ability to vote. My daughter turned 18, voted. My son, same thing, they're voting. And but when you're younger and you see this happening around you, it does sort of it's not a disenfranchisement, right? But it's sort of that they just don't have that control. It just highlights again that kids don't have that control. So I think that also feeds into some of what they're experiencing now.
Yeah, I think it's also important now because, well, adults, well, we are seeing a lot of polarization, but with children and adolescents is worse because their thought process is more kind of black or white. So I think it's also a good opportunity now to explain to them that you may disagree with some ideas. You also may don't like people who hold those ideas, but we should respect also people who and that the for children explain them that the people who vote in other direction are not our enemies, and you should if you have another ideas, you have to know why are you holding to those ideas and try to convince the others, but not trying to be violent against them or hate them.
Yeah, I think what you said also about the children actually know what's going on, and now they have all the information in their hand or their smartphone. There's a plethora of information, but even on 9/11, my oldest was in pre-K then, and I had gone into the schools to talk about Gandhi and peace in October, and we thought we had protected our children from what was going on, the terrorist attacks on the World Trade Center, and we'd lost parents in our town, but they all knew. And I remember months later, a baseball player's small plane crashed into a building on the Upper East Side of Manhattan. Corey Lidle's plane crashed, and my son had this visceral reaction because they had been pre-anxious about 9/11, and then this thing that he actually knew what was going on because he followed sports all the time. So I guess it was years, like, I don't know, sometime later. So I think, respecting that they have knowledge that they bring to the table is very important. Jessi, you talk a lot about the mental health of college students, and you've talked about it before COVID, and we're seeing some very different circumstances during COVID. Some kids are stuck at home with their parents. Some kids are in bubbles. Some colleges are very strict about quarantining and isolating, and some colleges have no mask policies at all. Can you talk to us a bit about college students, what they should be thinking about or expecting, what high school students who are having, their anxieties applying to college should look for?
Yeah, college students are this often neglected group that I feel very honored to be a spokesperson for. I think what happens is they're this group that has a lot of anxiety and depression and has always had a lot of anxiety and depression. It's also the time where diseases like bipolar disorder and schizophrenia start to come out. They also have a lot of eating disorders and substance use, a lot of peer pressure, and it's a lot of identity development. And a lot of the identity development is around socialization. And right now, socialization is weird, right? Like some of it is virtual and some of it isn't happening, and some of it is at home and some of it is not, right? And I think a lot of what happened was in March, a lot of schools either stayed on break and didn't come back, and that was really hard for people, or they were just in this perpetual, again, like uncertainty. And some people, home is fine and safe and a place that they feel comfortable, and some people, home is not. And I think people take for granted that home is a safe place. Some people, home, they can't even be themselves or have their real identity. And I think that is a big stressor for people. So we have a lot of people who are just really experiencing different circumstances, are away from a place that they were growing and developing and becoming the person that they were becoming, the place where their friends are, the place that they were doing their social activities, learning who they were becoming. And I think we're seeing in the data that we have, like the CDC data out of in June, the 18 to 24 group had among the highest suicidal ideation in the last 30 days. So thoughts of suicide in the last 30 days was up in like 26, 27%. And the kind of global group was in the teens, which was higher than it was before. But if you think of how much higher that is, that's significant. They also have the highest rates of loneliness of any group. And in the recent American Psychological Association group, that generation is the highest stress generation, most stressed about what's going on. And I think these are things we need to pay attention to. What that means means to me is this is a group that has a lot going on, is going to have a lot going on moving forward, and needs to have resources and things concentrating on them because they have a long future ahead of them and they are so affected by the world. I think college students for forever have been this super passionate, they just absorb everything about what's going on. They care about the world, whatever is going on in the world. They care about the environment. They care about racial justice. They care about, their peers so much, right? And so they are, speaking of people who absorb things that might not be even taught to them, right? They're very passionate. So their emotions fluctuate so much with what's going on. And I think we can't take that for granted. And we really need to invest in them, try to help them along with this. They have very little mental health resources in college campuses. They have long waits. They have a lot of difficulties getting into care. And we need to be trying to think about how to better address the need on college campuses so that they're not, going into their life without having had treatment, or they're not only getting crisis care when they're really, really sick. And that's the same with transitioning from high school to college. People have already seen treatment in high school and are sick and they might be stable, and they're going to college and they're not getting treatment because they don't have enough providers. And then they kind of drop off the radar, and then we lose all those people and we can't help them, and I think we need a better way of protecting them and doing a better job.
It's sort of not temporal. I don't know if it's temporal, whatever. But when I went to college, I would talk to my parents once a week. I always made sure I did. Just that was our thing. We'd call each other on Thursday, make sure everything was good. And I don't know, Suju, if you did that, but my kids FaceTime me. Okay, let's be real. Most of the time it's because they want something, but not always. They FaceTime me, so I feel like I see them. But, my daughter just started college and she decided to go there, even though most of actually all of her classes are now remote. But I thought it was important that she go as well, because it's a transition, and all the transitions of the high schoolers this year, and even college graduates, right? You didn't have a real graduation. You didn't have the prom. You didn't have so many things, spring break, all transitions of a high schooler and even college, right? And so I felt you have to go to college. But all those things you put up there, I just had this mama bear thing that I just wanted to see her. I needed to see her physically to be sure that she was thriving. And thank God she's thriving, but it could have been not. And I would not have recognized it on a FaceTime call, and I think that's also something, Parents Weekend. My parents never came for Parents Weekend, but the kids now, parents do go. And that was also something that was taken away. So I felt like I have to land there and see these children and make sure they're doing okay. Because it is as you said, Jessi, college, so stressful. And then add to it that it's the middle of a pandemic and their friends are getting sick. They have to go get tested every week. All those things that are just not normal for college life.
I think Jessi's 17 points that you put in that Self article, and maybe we can just put that slide up again, and guys, take a screenshot if you want. How can we help our kids use this to sort of try to start opening a dialogue so that we can help them? And if they need help, we can get it, because you're absolutely right. Interventions happen in crisis, and we know in all aspects of medicine, including psychiatry, the intervention that happens before the crisis or the healthy lifestyle prior will save a lot of angst later on.
Yeah, I've noticed a lot of time that both the parent side and the college student side, there's a lot of mind reading, and we really hope that people will just guess what we're thinking. And so my college students will slam the door and just be like, my parents must know what I'm thinking. They know I'm mad about this, or they know that, that this is what's bothering me. And I'm like, well, did you tell them? And they're like, no, why would I? They know me. They know what I'm feeling. Or, they don't text you for 2 weeks and they assume that that that's because they're angry or stressed out or something. And they assume you can mind read their emotions as opposed to actually communicating them. So I've had a lot of conversations on kind of both sides about how we need to have how would you like me to check in on you? what would it look like? How would it not be annoying and frustrating for me to say, what's your mental health been like? How has stress been? Are you feeling okay? I know that it's hard sometimes for parents, especially parents of kids who've had mental health struggles in high school, to like feel like they're ragging on their kids, because I think, and the kids feel the same way. Like the kids are like, I'm doing okay. Like when my parent repeatedly checks on me and is like, what are you doing? Are you sleeping? Are you eating? Are you functioning? They're like, I can't, like, it just makes me worse. Right. But it's love ultimately. Right. So it's just, how do we express that in a way that feels good on both sides? So I think it's a conversation that's like, these are the things that I understand that you could be struggling with. I've been struggling. This hasn't been easy for me either, because the pandemic is hard for all of us. These are the things I've been struggling with. Like, what would it look like for me to check in on you in a way that would feel safe or comfortable? How often would that be? Would that be an email? Would that be a text? Would that be a phone call? Would that be FaceTime? Like, what would that look like? And I think that that's important to be on kind of like both sides. And I think that that is the best advice I can give in that conversation, because both people can actually vocalize what it feels like, what it looks like, and then come to some sort of like mutual agreement. And then if you do that, you agreed on it. So it's not like you're doing something you didn't talk about.
Yeah, I thank you so much. I think this is advice that we need and that plagues us, because obviously we want the best for not only our children, but the children in our community. I'm reminding everyone we're live on YouTube and Facebook and Twitter. Thank you so much for checking in. Please tag your friends. I can't imagine anyone who would not benefit from listening to our two experts today. I see that Margaret Ambrosino checked in from Brooklyn, and Nalini Kuke checked in from Maryland. I see that Vijay Sundaram checked in from Ottawa. Thank you guys so much for watching. And please let your friends know to watch us live or watch us later, or listen to us on WBAI. We're on Mondays from 2 to 3 p.m. and Tuesdays from 5 to 6 a.m. for you early risers, which, Marina, is the time I was calling my mother from medical school, because she would wake up early to sing and I would wake up early to get to rounds, and we'd have a great chat about 4:45 in the morning when I was in medical school. Victor, we're talking about college students and anxiety, and frankly, college parents and their anxieties. What about children? What about children and adolescents? We're seeing the anxiety of not going to school. Then we're seeing the anxiety of going back to school. I had a patient this week, and I'm an ear surgeon, I'm not a psychiatrist, but she had an anxiety tic of sort of pulling at her eyelashes. That went away when her school went into lockdown and she was safe in her family bubble. And now that they're back hybrid, she's pulling at her eyebrow and she's nervous about how safe or not safe it is to see her friends. What do we look for children and adolescents? She's 12, but what do we look for in this age group?
Yeah, so in children and adolescents, we'll see some differences in how mental distress is manifested. For instance, in very young children, infants, what we could see is kind of a regression of abilities that were acquired. For instance, the control of sphincters. Also, across ages, we will see, especially in young children, adolescents, that when they cannot express with words their distress, they will have more ease to kind of somatize, to have more stomachache, headache, to feel physically bad. They don't know why. Also, irritability is very common in children and adolescents. Sometimes loss of appetite, loss of sleep. In some, because children and adolescents can also are more likely to have kind of atypical symptoms of mental distress, anxiety, and depression. So for many children, they may express their distress eating more with more appetite, or sleeping more instead of sleeping less and eating less. So, but what we will be looking for is kind of changes in their normal habits, changes in their baseline, changes in mood, and then in adolescents, so you will have kind of two possible reactions. One reaction is kind of more externalizing, So yeah, irritability, maybe aggression, kind of rebellion, and but also some adolescents can maybe withdraw, stop talking to friends, talk less to parents. So yeah, we'll need to be looking forward kind of a wide array of possible symptoms.
Jessi, thank you so much, Victor, for that. Jessi, this pandemic has made so many things just worse, right? Social interaction, the economic losses sustained in this country and around the world, all these changes that we've had to experience. I didn't operate for 9 weeks, and I realized that I completely defined my life by getting up and going to the operating room and seeing patients. Like that's like other people might, I sing, I dance, I do this. I was like, no, I operate, and this is messing me up. But is there a trend to what you're seeing in terms of the mental health issues around the pandemic, or is it that everything's up, or is there, as I just asked, a trend?
Yeah, I mean, I think, I mostly see I see adults in general and college students and grad students, and then I see healthcare workers, faculty, and staff. Right at the beginning, people were doing okay, and we're sort of like, okay, I just have to do the things I need to do. I need to get my stuff organized. I need to protect my family. I can do this 1 month and I'm going to be in isolation and I'm okay. But I think the longer that it's really gone on, I think that depression stuff has started to creep up. I think we started to see more anxiety at the beginning because of uncertainty. There's been uncertainty all along. There were even people at the beginning that were honestly doing quite well because they had some time for self-care, some time for themselves. And then the longer this has gone on, anxiety has gotten worse. If you look at those numbers, they're up in the 33% in some of that data. It's obviously subjective, even though our measurements that's as good of measurement as you can get for us. Those are using the best, objective measurements of subjectivity that we have, but they're doing the best they can. But it's, they're asking about sleep and irritability and concentration when we have so many things affecting that. So it's complicated. But I think as the longer it's gone on, depression has gotten worse. I think that what I'm seeing in my clinic, sleep is probably the highest, most common chief complaint, and then concentration might be second. I also think eating disorders have definitely been an issue. People turn to things where they can control things when things feel out of control. So you can revert to habits like self-harm or not eating because you know that you can control that or you can do something about that. Same with substance use. All of that has sort of been an issue over the pandemic as well. And the longer that's gone on, it's been not just a day of drinking after work, it's been 6 months of drinking after work, and that becomes more of an issue over time. So I think it's just kind of compounded everything. So people with existing mental health conditions that were stable for a really long time are starting to come out of the woodwork too, I would say. So people that were on the same medication for years and years and years and just got refills every 6 months have been coming in saying, I need an adjustment. And I think that's more common now too.
Jessi, do you recommend things like Headspace or Calm, one of these meditation apps? Because you said no sleep, and I've been sleeping great because I put on the meditation app. And of course, the guy starts talking. He's like, okay, find a comfortable position, keep your eyes open. And I'm like, okay, I'm in bed, I'm comfortable. I'm going to breathe. And then he's like, now close your eyes. I'm like, I'm already there. Friend. I'm right there. Okay, my eyes are closed. But I end up sleeping like a baby. I think my subconscious is hearing the next 8 minutes of whatever he's talking about. But the first 2 minutes, I'm like, yeah, okay. And then I'm out. I'm just out. I love it.
Yeah. I mean, Calm has bedtime stories too, where famous people with accents read you bedtime stories. So if that works for you too, I think that's helpful. I mean, I think it's what works for you. I definitely recommend those things if people like them. I always warn them that they're muscles you have to flex and they're not things that work immediately, because I definitely think that people think when you download Headspace that it's going to be the first time you ever listen to it, you're going to sleep amazingly. And then all of a sudden you're mindful and you can pay attention and it's awesome, but you might hate it. I mean, you might be like, this guy's annoying. Why is he talking like this? This is stupid. What is this talking about? And that might go on for a while. And you might turn out that you like it. It might turn out you don't like it, but you might need time. And I think that part is important to point out, because it might take time to like those things. And I think it's important to try them out if it's something you like, but definitely give yourself a little bit of grace that it's not something that you all of a sudden are going to be like, I'm a master of this like way of relaxing. You need time to enjoy it for sure.
Yeah, that can be, I mean, obviously that can be done with pranayamic breathing. It can be done with yoga. I'm a big walker. Like, I just like walking. People like running, but I think, you know, finding in yourself what calms you down, right? Victor, you know, we as parents, I have 4, Marina has 2. We used to be yelling and screaming about, you know, stop being on your screen and stop looking at the computer and stop looking at your handheld device. And now their school is on a screen and all their information is on a device. Can you talk to us about what's the right way to guide parents as they guide their children about screen time?
Yeah, no, it's been a big issue, especially because during COVID, well, it was already existing before, but during COVID especially, well, here in the United States, we were more or less lucky that children could go home, to the street. In Spain, yeah, some of my cousins and relatives, so children were locked down in their homes for 40 days. They could not go for anything, so that was pretty bad. But anyway, the risk now is that we have fallen into the screen time as the default time, because yeah, exactly, we have it for school, we have it for the news, even for connecting with friends. So I would say it's, I don't know what's the right amount of time. There's a big study published last week or a few days ago in the journal Preventative Medicine, and they use a very large sample, 30,000, almost 30,000 kids in Canada, and the results were very consistent that children that spent less than 2 hours a day in the screen and were also doing extracurricular activities have much better mental health. Now it's a challenge because now many extracurricular activities are also via Zoom or in the computer. But I would say not try to keep this struggle at home of thinking that the screens should not be kind of the default time or the default pastime for children. Encouraging creativity. There's one article in the New York Times challenging kind of the idea of boredom and how boredom sometimes leads to creativity and to free play, free exploration. So it's difficult, but I would say help parents make their children see that the use of a screen should be very intentional, not just to pass time. So, okay, there should be a time for video games, but more or less planned. There should be also a time for meeting with friends.
Right now, Victor, the big thing is, you know, I've watched my kids sit there and screen through Snap.
Yeah.
You know, they're just going through, and I'm like, okay, what are we doing? What's happening? They're like, they're just checking. And then they're like, I have a streak going with so-and-so. I joked, I like to torture my children, you guys. And so I joked with both of them that as soon as they go to college, we're going to have a streak of like Snapchat, you know, like just every day. And they just looked at each other like, oh my God, she's not going to do that. Now, I haven't, but I did try just for a second, just wanted to torture them. I want to shift gears a little bit to ADHD, which many times I feel like you guys saw that movie Up, right? With but they had the dog on there, the dog that was like, ball, squirrel. And I'm like, that's me. Like, I could be talking about something. I'm like, but there's that. Let's talk about ADHD. How are we managing that with the kids and maybe the college students and adults, like everyone's on Zoom now, and you don't have your ability to get up and walk to the water cooler or take a lunch break, because it seems like Zoom's just making everybody work longer hours. And certainly the kids are really, some of them start at 7 in the morning and they're going till 3 or something like that. It seems like very aggressive. So how does ADHD play into it? And I know that it is a focus of yours, Victor. So can you just describe ADHD? Who has it? Some of the symptoms.
Okay, yeah. So ADHD basically is a neurodevelopmental disorder. Between 5-15% of children would have it. More internationally or globally, kind of the most consistent prevalence is kind of 10%. It is known that in the United States the prevalence is higher. So and yeah, we have to acknowledge that it's mainly, true ADHD is a neurodevelopmental disorder. So we don't know very well how is it, what are the causes, but there are some genetic factors, and ADHD per se is not produced by screens. It's not produced by the family environment, although the family environment or other social factors can play a role in how ADHD is managed, is controlled. So usually children, adolescents, and adults with ADHD have these problems of focusing very, very consistently, not only in a specific task or for related to work or study, but they have problems with inattention, with impulsivity, in different settings. While other people who don't have ADHD will have a lot of difficulties in attention, and we will have in this Zoom world, we can create kind of our own biases of being multitasking. But if we make an effort, we are kind of able to control it, while people with ADHD have it much more difficult.
So can you talk to us a little bit about treatment? Because I know you've done some research looking at the medication and what it does to the brain. And then after that, maybe Jessi, you can weigh in and let us know your experience with ADHD.
So
Victor.
yeah, so when we treat patients, and when we meet the families and diagnose ADHD, we will usually say that the treatment of ADHD rests upon at least 3-4 pillars. So the first one is medication, and medication is the treatment with most evidence, with most effectiveness, and basically medications can be stimulants or non-stimulants, and usually the most used and as first line are stimulants like Concerta or Adderall, and other medications that are based on methylphenidate or amphetamines. There are also other medications, but also we want to stress that it's very important. It's key that as part of the treatment is kind of the education of the parents and education of the teachers and the patients to know that this is a disorder, that the children with inattention and with impulsivity, they are not mean, they are not bad kids, or their parents, they are not bad parents. They are trying their best, but they can do a lot to support better those kids, to understand them, and to create maybe a more structured environment at home, and also a more supportive environment at home, not to blame them for everything. And then so medications, education, and sometimes for many kids they are benefit of adaptations at the schools, support at school at different levels. And with medications and with all these treatments, we don't want kind of to drag the kids. What we want is to make the kids able to be at the same level as others, and to make their efforts have fruit. And in this research, so we were trying to find how medications are affecting the brain. So apparently, well, there's a lot to study yet, but apparently the stimulant medications seem to kind of normalize the disruptions of the networks of the brain of children. In children, their brain, one of the most solid hypotheses is that the networks are kind of very, very messy. So with medications and with support, we are trying to make their networks kind of work more effectively.
Thank you. I think that's really helpful. I think this is a huge issue that we are learning about every day. Jessi, what's your take on it?
Yeah, I mean, the only thing that I would add is, so since I see a little bit older kids, like sometimes what happens for like college students is they actually did really well in high school. And what happened was like their parents were doing a lot of things to make it so they could survive. So they're really good in school. And then you didn't notice these little things about them because like they would forget their lunch, or they would forget they'd lose their phone, but their parents would always be like, hey, did you remember your lunch? Or hey, did you remember your phone? Or hey, don't you have a test today? So then they were like constantly prompted. And then when they went to college and they didn't have the prompting and they didn't have someone organizing for them and they don't have all that, it's all of a sudden like, oh, that's what was going on. And a lot of times we actually diagnose ADHD in college because of that. And so that's something to pay attention to. And in adults, something that's important too is like concentration. A lot of things interact with concentration. So sleep, feeling anxious, feeling sad, all affect concentration. So when you might feel like you're having ADHD right now because the pandemic is making you not concentrate, it's much more likely to be that you're not sleeping and you're feeling anxious than you miraculously just got ADHD as an adult and you've never had symptoms before. So I think that that's also important to keep in mind, and I would just throw that out there too.
And that's really important because you're right. If I'm with any parent, child, not even my own, but of course I do it too. They're like, where's your gloves? You're going outside. It's cold. Where's this? And it's a constant thing that you doing just so that you could protect the child or make sure that they don't have an issue, that they remember their books so they can go to school, all those things. How could you forget your homework? And those seem to be like little minor things, but actually could be and are reflective perhaps of a bigger problem, of an actual diagnosis. So that is such an interesting point that you brought up. But I do want to shift gears a little bit, although I think that with our viewers, and if you guys are watching on Facebook, YouTube, we're also on Twitter, and you want to like or share, you absolutely can. And if you just started watching, you can get the replay and on YouTube and Facebook. And you can also listen to us on WBAI, which is 99.5, and they play us on Mondays from 2 to 3. But, we want to shift gears because, as I said earlier in the show, we have two Twitterati. They're both very well known for what they do in medicine, but Jessi was involved with Time's Up Healthcare, so we definitely want to hear about that from you, Jessi, and what that means and where we're moving. And it's just been a great year because and with the election and everything, I think it's very timely. And then also, Victor, we want to talk to you about the worldwide training community that you've created. So, Jessi.
Yeah, I mean, I've been very lucky to have been involved as a founding member, and I'm on the steering committee for Time's Up Healthcare, which is basically a carve out of the greater Time's Up system, which came about after Harvey Weinstein, really. And the farm workers said to the Hollywood, the women in Hollywood, like, we see you and this is happening to us too. And the women in Hollywood were like, oh, wow, it's happening across industry. And what happened as a result was they set up the Time's Up Legal Defense Fund, which helps with publicity and helps with supporting legal cases that have to do with harassment in the workplace. And they fund them basically pro bono completely. And so we saw that happening. And at the same time, we're having all of these gender equity discussions in medicine and across the, medical spectrum, not just MD medicine. And we're saying, like, why are we not in this conversation? And reached out to them and said, we have all this research. We've been doing this research for so long. We would love to be a part of this. And that's really how Time's Up Healthcare was formed. And it's about, equity, safety, and dignity in the healthcare workplace. When we were founded, there are over 50 women across the healthcare spectrum. So not just MDs, so nurses, people in pharmacy, people in administration, working to create a space where we could talk about the issues in medicine and the things that we need to discuss. A lot of stuff, I will say, has gotten a little bit hard with COVID because a lot of us have been frontline workers, and it has been a hard time for a lot of us, but we're trying to figure out how to, there's so many issues of like sort of this overlap between racial equity and gender equity right now that I think there's a lot of momentum and a lot of conversations that we are excited to be a part of. With the election, we were helping Times Up Proper with some of the, press around what they were saying about Kamala. And if you looked at sort of any of the other women candidates, kind of the press was very biased, and like doing a very, in social media, trying to call that out as much as we could. But we're trying to be in the conversation around that as much as we can, trying to be a space that people in healthcare can turn to for legal representation, and the Times Up Legal Defense Fund, someone that they can turn to for advice and someone they can turn to for help. And as a mental health care provider, I'm hopefully going to eventually be more in the space of trying to figure out where mental health fits in the conversation for survivors and supporters where that is possible, and have, been putting out with Times Up. As a Times Up healthcare member, they've been doing some studies on mental health in the election and in the pandemic and for women. And I've been helping them digest the data and putting out some of, some speaking conversations around that with another member, Dr. Callie Cyrus.
Just you guys watching, you think, oh yeah, no, I know harassment, sexual harassment happens, and, other, like in the corporate world, and it happens everywhere, and it certainly happens in medicine as well. And of course there is a gender equity thing, but there's and the passing over for promotions and all of those things, but there's absolutely sexual harassment. I think every single one of us can. Even Victor, I'm sure you've been harassed. I have to be careful. I joke around with my residents. I'm like, wait, no, that's not harassment. I just was, so you have to be so cognizant. And sometimes harassment isn't a sexual thing, but it's something where you make somebody feel uncomfortable. And that's a hard pause and something to step back upon. Victor, can you talk to us about what you set up, what issues that you found out to create this worldwide network that you have founded?
Yeah. So all this started during my residency in Spain. So residents, when we are in the residency, we have a lot of things to take care of and to worry about, and especially our night shifts or salary, a lot of things. But we also realized that as residents, by ourselves, we are not able to change, to advocate for ourselves and for our colleagues, to be trained well, to also be able to take the best care for our patients. We cannot by ourselves advocate for social justice, for access of mental health care. I started connecting with other residents in Spain, and eventually in Europe, and now in the world. So eventually in 2018, I created this world network of psychiatric trainees, or UMPT. So now we are connected online via WhatsApp group, email, social media. We are right now more than 230 members from more than 50 countries, even from countries that many people in the Western world don't know they exist. Actually, one of the persons that is watching us is a resident from Ethiopia, and we are now doing a collaboration in training medical students in Somalia. With this network, it's a great opportunity to kind of have a global mindset, know about the challenges of psychiatric training in different parts of the world, and also to collaborate together to bring also research perspectives of mental health across the globe, and also to learn more from each other. We do a lot of webinars, we do research projects, and it's been great.
So, I think all of this takes some of that stigma away from mental health, puts it back where it belongs, which is in an arena that is so important. We thank you, Catherine Bass, for saying it's a great subject. It's a great subject. I think Marina and I could talk to you guys for hours. But unfortunately, we have 1 minute left. So if you don't mind leaving us with one pearl, each of you, we'd really appreciate it. Jessi?
Yeah, I mean, I think I would say there's no normal reaction to a pandemic, and everything that you're feeling with the pandemic, systemic racism, an election, your kids being at home, you losing your job, whatever you're dealing with is completely normal. If you need help, get help. It's not shameful. It's strong.
And Victor?
Yeah, so children, well, and adults, but children these days will be very much marked by this pandemic, but all that happened this year. So let's strive for this post-pandemic or post-traumatic growth. Children have also not a lot of flexibility and a lot of vulnerability to be damaged, but also a big capacity to grow and to make the best of it.
Thank you guys so much. I mean, we can't do this show. Thank you both for joining us, and thank you all for watching. But so you guys know, we can't do this show without some great producers and behind-the-scenes work. And so we want to thank our producers. And we're going to cue our next show, which we should be talking with our GI colleagues next week. So stay tuned for our 23rd show, where we're going to be talking about things GI with Dr. Lisa Ganju, who's from NYU Langone, and Dr. Ali Shulman, who's a gastroenterologist, advanced gastroenterology at University of Michigan. Go Blue.
Thank you guys so much for watching and listening. And thank you so much to Dr. Jessi Gold and Dr. Victor Pereira-Sanchez for sharing your wisdom with us today.
Thank you.
Thank you.